welcome everybody. Good morning, good afternoon, and welcome everybody to this first of many webinars we're hoping to have in this health administration section of MPHA. And it's an interesting, topic, and I'm excited about it. Looking forward to learning a lot from Aubrey. But before we step into the actual event, a few things, please. If you can, type your name and your organization or location in the chat so we can know how far and wide we are able to attract the audience. We'll appreciate that if you can do that to introduce yourselves. And then I want to also recognize our executive director for the Mississippi Public Health Association, no other than Lydia West. She's right here with us. And also, I have my executive members of the Health Administration section, which are Dr. Jared Gant. He's our vice chair or co-chair, taking over from me next. And then we have Dr. Yolanda Barana. She's our secretary. And then we have Latasha Michael. She's our treasurer. So I just want to allow the Lydia West a few minutes to say something to our audience, and then I will introduce our guest speaker.
Thank you. I'm very excited to be here. I am rather new to this role. Our previous executive director, Kay Bender, who many of you know, retired on June the 30th. And so very big shoes to fill, and she's continuing to be a great mentor. I'm very excited to be here. And I'm with the Public Health Association, and this webinar is being offered through our health administrator section. And we have many sections that work with different specialties, from nursing to social work, research, and then our health administrative section. And they're got lots of great stuff planned for this next year. I'm going to put our website in the chat, and if you're not a member or if your membership may have lapsed, I'd like to encourage you to join us. Our tagline is, "We're the voice for public health," especially in Mississippi. And we have 3 pillars that we tend to stand on around education, like what's happening today, leadership, which all of you are, and we're the advocates for public health in Mississippi. So you'll see lots of small P policy happening throughout the year, but I've been in several legislative meetings today, so we're gearing up for the 2026 legislative session in Mississippi as well. So thank you for all this work, and I'm looking forward to learning with everyone.
Thank you, Lydia. So I'm going to introduce our guest speaker for today, and the appetite in my ears, really, really high expectation, ready to learn from Aubrey. So Dr. Prepe is a distinguished leader in the field of surgical services. She's currently serving as the Senior Director of Surgical Services at St. Jude Children's Research Hospital in Memphis, Tennessee. So Aubrey holds a Master of Science in Nursing with a focus on healthcare administration and a Doctor in Healthcare Administration. She's a Lean Six Sigma Green Belt. Yeah, that's a good one. A certified nurse executive and a certified nurse operating room professional, underlining her commitment to excellence and innovation in healthcare. With a robust background in healthcare administration and over 18 years of experience, Aubrey has demonstrated exceptional expertise in managing complex hospital departments, including surgery, sedation, radiation, oncology. She is instrumental in maintaining regulatory standards and overseeing departmental budgets, contributing significantly to the hospital's successful accreditation, to the Magnet Recognition Program, and the Practice Transition Accreditation Program. So prior to her role at St. Jude, Aubrey held key positions at the University of Mississippi Medical Center, where she advanced from OR manager to director of pediatric perioperative services, and her leadership was pivotal in managing operations at a level 1 trauma center and spearheading the construction of a new surgical suite. Interesting. Aubrey is not only committed to organizational excellence, but also passionate about nursing, education, professional development, and she served as a peri-operative nurse educator and interim director of education and professional development, focusing on enhancing staff competencies and fostering growth. Her dedication to nursing leadership is further reflected in her active participation in various hospital committees and holding leadership roles within professional organizations all over the country. I really want to recognize Dr. Pepe and thank her so much for her time. And also let you know she has a Mississippi area code on her cell phone, so she's still one of us. Very much a Mississippian. Well, so I just want to open up the floor to you, Aubrey, to take it away.
Thank you so much. I appreciate it. Um, I was really flattered to have the opportunity to come and talk to you guys today and share a little bit about my background and my pathway into health administration and why I'm so passionate about this topic and about developing leaders along the way. So thank you guys so much. I am very much still a Mississippian. I live in South Haven, Mississippi. I do still have the Mississippi area. So I am here along the way, a Mississippian at heart. So thank you. All right, so we'll go ahead and get started here with our presentation. These are our objectives for today. I am,
I'm sorry,
we'll
Dr.
talk.
Pepper, we can't see your screen if you were
Oh,
sharing your slides.
well, thank you for stopping me. Um, Let me try again.
One thing, while Aubrey is getting her screen put together, the health administration section, we have an assessment to determine the needs of health administrators in the state. So we're going to post that link in the chat. Please click on it and respond to it. Dr. Michael has just posted it on the chat. It's a brief assessment of health administrators in the state to determine the needs we have and encourage us to provide effective and targeted webinars to meet those educational needs. Thank you. Over to you, Aubrey.
All right. Can y'all hear me?
It all looks
Okay.
great.
Okay, great. Let's try again. I think I clicked on the wrong screen. So there we go. Okay, yay. Try again. All right, so our learning objectives for today, because any presentation needs to have some learning objectives, are to reflect on some key leadership lessons in health administration, talk about how personal growth can align with organizational and team development, and hopefully to inspire some of our new and current healthcare leaders along the way. So um, here's my disclosure statement that I have no financial relationships or conflicts of interest, and that this is just intended for educational purposes. And then let's see. You already heard Miss Rita's beautiful introduction about me. And so I have been a nurse for 20 years now, with 13 years of that being in various nursing leadership roles, including my current role as Senior Director of Surgical Services here at St. Jude. I've been at this organization for 7 years, which have been wonderful opportunities to see this organization grow and contribute to the mission here at St. Jude. But prior to that, I was the director of pediatric perioperative services at the University of Mississippi. So I definitely have a special place in my heart for our Mississippi public health colleagues and for the work that you guys are doing. I do indeed have my doctorate, master's, as well as dual certifications, both clinical and leadership. But what I will tell you about that is, although all those letters look and sound very important, they are efforts that were made because I desperately needed help to support and have the education and knowledge necessary to care for the patients that I cared deeply about. My master's degree was initiated after I got the role of the manager in the operating room at Batson Children's Hospital, and I realized really fast that I needed a lot more knowledge and expertise than what I currently had to do justice to the role that I had been granted. So, and that kind of that's going to lead me into my first point, which is about how we grow as leaders. But I couldn't start this presentation without introducing you a little bit to my why, right? So when I am not serving as the, when I'm not tied up at the hospital, this crew is somewhere in tagging along with me, my daughter and son, Lillian and Wesley. And this motley crew of animals that we have here. We initially had 2 dogs and 2 cats, and then this little orange alley cat adopted us. And have to be honest, there are times where I like him better than all the rest of them, including the humans sometimes. So they keep me centered and they keep me, they remind me why this work is so important that we do. Um, and I couldn't talk about my family without sharing my family here at work. So the team that I work with here at St. Jude is an integral part of the work that I do, and I am only as good as the people I have around me, and I can say confidently that I have some of the very best. So over here in this Christmas picture are some of my managers and our lovely chief nursing officer. When I graduated with my doctorate back in 2024, my managers took me to lunch and everybody got Dr. Pepper shirts. So it was a wonderful celebration because they stood by me through all of that as I was pursuing my doctorate. Um, this picture down here in the Taylor Swift era is our procedures team who won the Team of the Year award at the hospital that year. And they were advertising for recruitment of nursing residents and sharing that they were one of the best teams to be a part of. And on the right, you see we are at engaging in community service where one of the, don't go away, sorry. Get my screen back. We were where we donated Christmas gifts to a local after school program. And then on the bottom right hand is our nursing director, our executive team that having a little bit of fun during Nurses Week. So that particular day, I think was Western Day. So my first point here that I wanted to talk about is that growth starts with self-awareness. I shared with you that I pursued my doctorate and master's and certification out of a desire to better serve the people that I was leading. And I realized really fast that I needed more than what I was initially equipped with. And as I started my master's degree and really delved into learning about serving as a leader, one of the first things you learn about is your leadership styles, right? So you hear about different styles of leadership from autocratic leadership, transformational leadership, and you kind of form these thoughts about what you think a leader is. But along the way, you learn what your particular style is and how to lean into that. And for me, one of the big lessons that I learned along the way is that I could lean into any of these styles if needed for a role that I had to carry out. Now, some are going to be more comfortable than others, but the work, there are going to be times when your job may require you to be transformational. As you lead change in an organization, you may have to really embrace the qualities that help someone find success as a transformational leader. But there may also be times when you have to lean into an autocratic style. I remember vividly the first time I had to do that as a leader. I always said I would never be autocratic. I thought that's a terrible leadership style. You're telling everyone what to do. But when I first had a facilities emergency in my operating room, and I had to shut down all of the surgeries, um, I had to be autocratic. I had to clearly articulate a plan, assign roles, engage everybody, and move promptly in order to ensure that families were updated, surgeons knew the status of the facility, and that we had a plan moving forward. And that was totally appropriate for that particular environment. The leadership style that I probably closest aligned to is authentic leadership. And the other leadership lesson that I learned that I really closely identified with was that of situational leadership. Um, I have different team members that will have different needs, and modifying my approach for those situations is often necessary. Um, there's a quote by Dr. Phil that says, "You can't change what you don't acknowledge." And Peter Drucker says it a different way. He says, "You can't manage what you don't measure." But really, the lesson here that I learned along the way was the importance of really starting with myself and really working on myself to be able to better guide others. As a leader, you're often asking people to reflect on their own practice. You're asking people to reflect on the way they engage with others, including their patients, including their colleagues. And if you cannot model that, it's going to be really hard to ask that of others. So that was probably one of the first things that I learned. The second lesson that I learned along the way was regarding relationships. Um, so relationships are very much a foundation of any type of leadership role. This was further underscored when I did my doctoral research. I wanted to understand what skills and competencies were necessary to aid new leaders in their transition to practice. And when we shared the AONL competencies, which relationship management is one of those, that was rated number one by all of the participants as the number one most important skill that a leader required in order to successfully transition to a leadership role. And boy, did they have a lot of reasons why that was the case. And I'm sure you guys would probably echo those feelings. I know I certainly have had positive relationships. I've had challenging relationships along the way. Um, but one of the lessons that was so very, very important to me was that about healthy boundaries. Nobody necessarily really tells you how important it's going to be to set those boundaries early. And I was very, very fortunate early in my career to have a mentor that um, sat me down early and said, "This job's going to be here when you're gone. This facility is going to be here when you're gone. You have to protect and preserve yourself and preserve your own boundaries to be able to continue to show up and bring the best of yourself to everybody that comes here. So you need to close the computer at night, quit sending late emails, quit engaging in this work when you're outside of here, and trust that your team can support you." And she offered the perspective that when I did not give others that opportunity to step in and to carry some of the weight, that I was denying them the opportunity to learn and develop. And when she shared that with me, I had a big aha moment. I was like, oh man, it's not that I don't trust them, it's that I didn't trust myself. I didn't know enough about what I was doing to be able to confidently equip someone else. But if I denied them the chance to develop, then I was inhibiting others. I have carried that forward with me from that point on and instilled it in other leaders that I have mentored to this day. I often will sit down and be like, okay, we've got to take a break. I need you to step away. I also have established ground rules with the leaders that I work with, such as I'm not going to email you after 7 p.m. If there's an emergency, I will pick up the phone and I will call you. So if you see a phone call from me at 8 o'clock at night, you need to pick it up. But otherwise, I want you to have your time with your family. So having strategies like that have helped me to have boundaries. Um, Other relationships that are super important include identifying a mentor and being that mentor to others. So for our emerging leaders and really even our seasoned leaders, I will tell you, you're never too far along in this journey to not need a mentor. Everybody needs someone they can go to process things that they're experiencing. Um, And it's really important to advocate for yourself in finding that, but also to be that person for others along the way. And the lesson that I learned in this was that I got just as much out of being a mentor for others, if not more. Because when others would come to me and we would talk about how to handle certain situations, it challenged me to really be able to speak to why we do things, why those things are important. And I really had to reflect and think on that before I advised somebody else. But the act of doing that and investing in others was such an important part of my development as a leader that I think it's one of those things that I try to encourage others. Not only don't stop yourself being mentored, but to also be that person to others. The next thing I want to talk about is change. So I think that each of you probably are experiencing change at an incredible pace. Um, and you will continue to experience that. I still remember one of my first nurse managers standing up in front of our staff meeting and saying, change is coming, change is here, change will continue to come. You work in healthcare. We've been evolving for years and will continue to evolve. And that is no different in your role as a healthcare administrator. We face so many different moving targets from financial and economic changes, medical and technology changes. The demographic that we support will have changes and their health needs will change as services evolve around them. I'm sure every single one of you has experienced some workforce changes over the past couple of years, both with availability of resources, training of resources. Um, I still have a certain place in my heart, our pediatric anesthesia group across the nation. That's a huge, shortage we experience with pediatric anesthesiologists, and that's like a systemic workforce challenge across the nation. Um, but one of the things that I think is important to recognize in your role as a healthcare leader, and that I had to recognize, was that how I respond to change sets the tone for my team. Jeannie Romedy, who was a former CEO of IBM, made the statement. She said, "I've learned to always take on things I'd never done before, that growth and comfort do not coexist." And boy, that is not necessarily a fun thing to hear, right? I like to be comfortable. I like to be um, confident in what I'm doing and to know that I have the answers. I get a lot of pride out of being really smart about something, and it makes me feel good if I know the answers. But when you know the answers, a lot of times you're not learning. And what I had to realize is that by stepping out and embracing change, both within my profession and healthcare, but also embracing change in new roles, um, that I got better as a leader and could then learn from others. Um, One of my best examples of that is when I agreed to take on the Department of Apheresis here at St. Jude. Um, our apheresis department does all of our stem cell collections, our red blood cell exchanges, and our sickle cell patient population. And they have an incredibly specialized skill set that is really rare in across the profession. You don't see huge apheresis programs out there, so it's a less common skill to have. So when I agreed to take on that team, I knew zero about that particular type of work. But I I knew how to lead people. I knew how to manage a department, and approaching them and expressing a willingness to learn gave me the opportunity to join in with that group, to lead that group and learn about the work they did. It gave me an opportunity to advocate for them and see their development and growth. And that is one of my favorite teams that I have the opportunity to lead now. And I have seen such incredible work from that team. Our entire bone marrow transplant program could not exist without these nurses. And the work that they do is incredibly technical, but also so specialized how they support families and patients as they go through donating stem cells for these procedures. And they're lengthy collections. A lot of these patients are hooked up to machines for 6 to 8 hours at a time, and these nurses are right there with them through the entire experience. So, and I wouldn't have ever had the opportunity to learn about that or to know about that if I hadn't been willing to take on something new and different. So the lesson there is to really not back away from change, but to embrace it and understand that you set the tone for others. It's okay to be afraid, and it's okay to be vulnerable about that. But it's important to also then move forward and to set that tone for others. So, next lesson. This one is super important to me, is to lift others as you climb. So, I have had wonderful opportunities in my career as a service lead for ENT surgery, as a perioperative educator, as a manager, and as a director. But what gives me the most fulfillment when I look back on my time in each role has been the development of others along the way. When I was the educator for Batson Children's Hospital, I was able to be a part of the development and implementation of nursing residency within the operating room. It was something that at that organization we had not done previously. So the implementation of residents in the OR was a new concept, but we believed we could do it, and we believed we could make it a positive learning experience, and thereby influence attracting people to perioperative services as a area for their profession. Not only were we successful in bringing nursing residents into our operating room, but I can happily say that when I look back at the leadership team that's there, the very first nursing resident that we had, her name's Haley Moore. She went on to be one of our orthopedic service leads within the operating room. She went on to serve as the nursing educator as she grew, and then ultimately took the manager role, and then succeeded me as the director. So the wonderful success that I saw through that was that the investment that you make in others is worth the effort. She made me a better teacher, and I was able to support her and share opportunities so that she was able to grow. And I still, to this day, make it a point to invest in supporting students, whether it's through our master's students, our bachelor's students that are getting their hours with nursing leaders. And I would strongly encourage any and every one of you, as you have these opportunities, there's privilege associated with having these positions of healthcare leadership. It's a gift. You have a gift to look at things differently, but you also have a gift to impact the lives of others. And really opening up to share that gift, that privilege that you have in these roles of responsibility in the development of others, it opens a door to others that they might not otherwise have. And that investment can pay dividends years down the road to the profession that you currently serve in and to the teams that you support. When you think about that on a larger scale, the development of succession planning and really focusing on workforce development is another important lesson that I've learned. I had not, up until I moved to St. Jude, seen a systemic, organizational succession plan implemented. And what I learned from that, from being a part of that, was how important it was to have that internal pipeline. Um, that internal pipeline for leadership development helped really insulate our organization when COVID hit because we had such a strong pipeline of leaders that had been developed through an organizational succession plan. And I saw across other organizations that they experienced a great deal of turnover and struggled without having that succession plan in place. So, both on an individual level as a mentor to others and training others, but also as a healthcare leader, you have the opportunity to influence and hopefully help be a part of developing some type of succession planning for your organization. That type of work is such an important part of ensuring the continuity and the development of others so that there are healthy transitions as people grow and go on different paths in life. All right, and finally, I will tell you the last lesson that I have is to lead with purpose and heart. I can still tell you the mission of Children's of Mississippi was to touch the life of every child in the state of Mississippi and help them reach their full potential. And every staff member that I interviewed for surgical services at Children's of Mississippi, I shared that mission with them. And I wanted them to know that we were recruiting people and hiring people to help us carry out that mission. So that meant that every patient that walked through that door, that our job was to help them reach their full potential, to touch their life and help them reach their full potential. When I moved to St. Jude, the founder, Danny Thomas, started this organization based on the belief that no child should die in the dawn of life. And our mission really was to treat catastrophic illness of children across the globe and help identify cures and treatments. And when I came here, that was a vision that I embraced. But even beyond that, as a nurse, um, we commit to be learning, to caring for others. And each of these elements are part of my center, my true north for why I do what I do. Probably my favorite passage is that from Mother Teresa, where she says, it's called Do It Anyway. People are often unreasonable and self-centered. Forgive them anyway. If you're kind, people may accuse you of having ulterior motives. Be kind anyway. If you're successful, you'll sometimes find your friends and you'll have some enemies. Succeed anyway. If you're honest, people may cheat you, but be honest anyway. This whole passage really talks about the importance of doing things despite what others do. And really, because it was never about them anyway. It's about you doing the right thing. It's about you leading from your core of what you believe to be right and where your true values are. And if you keep those things at the core of what you do, if you keep your patience at the core of what you do and lead with that purpose and lead with your heart, then you're going to find that all the rest of this, all of the other lessons along the way, they will fall into place. So each of these lessons put into action really helps is how I have grown over my career. They're hallmarks that have taught me something along the way. But I'd like to give each of you the opportunity also to share some of your lessons with me. So you should see here, I hope you see here, an opportunity to join at slido.com. You can log on your phone or you can take a picture of the QR code and share with me if you had an opportunity to share with others a lesson about your healthcare administration journey or how others might find success on their healthcare administration journey. What would that lesson be? Mhm. There's some great feedback here. I love this. So not everyone thinks or works in the same way. Absolutely. Lead by example, assuming positive intent. Trade judgment for curiosity. I feel like that might be a Sarah Curry response. I've heard that before. Sometimes you have to think outside the norm. Yes, absolutely. Go slow to go fast. Yes. So there's so many lessons we can all learn from one another along the way. I've shared with you a few of mine. I will definitely take these of yours with me. Um, we can all continue to learn from each other. I will tell you that no one has it all right. I do not have everything right. And I've gotten a lot of things wrong before I was able to find the right way. Uh, if I were to add a sixth lesson along the way, I'd say that failure is growth. When you get things wrong, learning from that and improving along the way. Um, but we all have lessons to share with others, and I think that's probably something we can all benefit from. All right. So we have a couple extra people still responding here. Ask questions, listen, don't judge. Yeah, some great feedback here. Thank you all so much for that. So we have time now left. If anyone would like to ask any questions.
Thank you so much, Aubrey, for this beautiful presentation. Really, so many lessons here that I was taking notes. I know you're going to give us a slide, but I was taking notes anyway because I wanted to remember some specific things that spoke to me. I know some people may have questions to ask, but I want to ask this question. You know, in being a leader, how important and how can we really develop emotional intelligence?
That's a great question. So I think one of the things to recognize is that emotional intelligence is one of those things that can improve, right? So it's not a static skill. It's not something that cannot change. But an important part of developing emotional intelligence is being willing to take feedback and to apply that. So sometimes that requires listening without judgment. Um, it also may even require seeking out feedback. I will have a couple of people along the way, and I can pick out names of people that have been kind enough to me to give me very frank feedback as colleagues and peers. When I started as the OR manager at Children's of Mississippi, there was a particular surgical tech that I could always count on to be very frank with me. She was respectful about it. She would wait until we were done, and she would go to my office and she would say, "Okay, what was that? I don't know what you were trying to accomplish there, but that was not it." So, um, and I mean, I always appreciated it because she helped me center myself and say, "Okay, well, that did not land the way that I intended." Um, so the best way that I have found to really grow emotional intelligence has really been to actively pursue that, right? To actively pursue personal development, to actively seek out feedback, to engage in that process of learning and developing yourself and being willing to apply some of that feedback that you receive from others.
Yeah, I think the challenge many of us have is really being open to that feedback.
Hmm.
Some people are afraid of it. They feel it could discourage them.
Hmm.
But I think it's also important for us to see the value of when you put that feedback into action and see the product and how it changes the dynamics in your team. So there's a question in the chat that I want to read out before I move to the next one I have. It says, what aspects of mentorship really assisted your development and future opportunities? This is from Raymond Riley.
Oh, Raymond, my entire career is been benefited from the mentorship of others. And my first OR manager taught me how to knit. And she spent time teaching me as a circulating nurse and helping me learn about healthcare and how to process things while we were knitting. Um, when I
Wow.
went on to be a peri-op educator, I had a phenomenal director who included me in everything. Even some meetings that some people would have been, you don't need an educator there. She would include me. And so I got to see policy development. I got to see how different executive and administrative decisions were made. I got to see the system of healthcare working. And her mentorship and guidance really helped me to develop as a leader to get to the point where I was ready to take that next step in stepping into a management role. And then even she went on to do other things in her career. I still stayed in contact with her and some of the other nursing leaders. One of our former um, managers from UMC went on to take a nursing director role at a surgery center in Phoenix, Arizona, and then came back and was a chief nurse at Women's Hospital in Flowood, Mississippi. And I would still reach out to her, and she would, give me a great perspective from somewhere outside of UMC. At that point in my career, that was the only place I had ever worked. And so when the opportunity came to apply for St. Jude, I was a little afraid. I was kind of scared to step out and um, consider moving, everything that would imply. And she was just a wonderful resource to, help me think about what some of the potential impact would be if I, took that step and what some of the opportunities might be. So I'm always grateful for these people that have served as my mentor along the way. And I think some of the reasons I've had those relationships has been that I've been open to their feedback. So if you're willing to be mentored, people will support you. And then along the way, because I had those hands up, right? Because I had those people to guide me along the way, it really made it extremely important for me to be that for others. Like I wanted to pay it forward. And I've had the opportunity to do that. And I'll tell you, Raymond, it's probably one of the most fulfilling things of my career to be able to mentor others and see them grow and find success.
So are you taking mentors now? Mentees, rather. Are you taking
hmm
mentees now?
hmm
Okay. If some of us are interested, we'll have to find a way to get you. So please, for those of us in the audience, we have 3 links. One of them is an assessment to determine future events, and the other one is evaluation for this event. Please click on the evaluation and give us your feedback. And then finally is the link to our YouTube. You find it somewhere. I think, Lydia, if you can post that again so that those that are joining us can see that link. Now, there's another question that popped up. How do you ensure employees are prepared for and understand the rationale behind change? This is Patricia Mundy.
That's a great question. I think that you pointed out something really important. How do you ensure they understand the rationale behind change? And that's really the key, right? We're nurses or we're healthcare professionals, and most healthcare professionals are wired to need to understand the why. They need to know. And if
Yes.
you can't articulate that, then it's really hard to get behind change. Sometimes that means you need to get yourself together and determine how you're going to respond to that change. And I've had to get myself together a couple of times and even go to my leaders and say, I will do this. I will carry this out, but I'm struggling, right? I'm struggling with this change. Help me understand why we have to do this. Help me understand how I'm going to message this. Help me articulate it. And sometimes I have to process it myself um, before I can take it forward. Um, and somebody said earlier in the word cloud, go slow to go fast, right? The time it takes to invest in aligning with your peers and other leaders so that your messaging change in an aligned fashion is a worthwhile investment. so that when you go to your teams, when you're bringing a change forward to your staff, that they're not hearing one message from you and one message from another person. That time and investment is super important in ensuring that that you're sharing a consistent message. But ultimately, I think really explaining the rationale behind something to people is probably the number one way that you can really help them adapt and embrace change. And I mean, if it's financial, then it's financial, right? So sometimes we have to make a change for financial reasons. And sometimes you have to say that, right? Because, without sometimes in order to move forward as a business, you have to make financial decisions. It doesn't mean that our mission has changed. It doesn't mean that our purpose has changed any, but we have to stay in business in order to carry out our mission. So we may have to look at how we do things differently. And I think inviting people to give that feedback, right? Give that feedback to you through the change, say, well, we're doing this, but it's not working. So how do we adapt? So I hope I answered your question.
Yeah, thank you so much. And the truth is, like you rightly said, healthcare is made up of a lot of professionals, and most of us have some maybe a theoretical reason behind something or some model we're following or something that
Mhm.
structures our thinking, and that rationale has to be applied even in our conversations about change. But unfortunately, change seems to be something that we're going to be seeing a lot in healthcare.
Absolutely.
Yeah. So Courtney has a question. Is promoting from within the best way to keep employees from leaving?
Well, it's certainly a strategy, right? I think that it's probably it's something that you need to be working towards, right? If an employee doesn't have the opportunity to grow internally, they may seek out the opportunity to grow externally. Um, Now, that should not determine your hiring decision, right? You should hire the appropriate person for the role, the person who is best fit to lead a team, the person who is best fit to be successful in the role. We're not going to do anybody any favors by prematurely hiring an internal employee and not setting them up for success. So sometimes that's feedback like that's hard to hear, right? That you're not ready. Um, but the flip side of that is if you're going to tell somebody you're not ready, then what are you going to do to help get them ready, right? What kind of opportunities and feedback are you going to share with that employee to help them get ready? Because it's not going to do anyone any good to discourage them from growth if we're not then allowing them opportunities to kind of to apply that feedback and to really work on growing themselves. So yes, promoting from within is a wonderful strategy for retention, and I strongly encourage exploring that. But it's also important to make sure that you're making sure they're ready, that you're setting them up for success in those roles, and then helping them along the way.
Yeah, I like that the way you put it in, Aubrey, because there has to be a balance on both sides. Because at
Mhm.
the end of the day, if you hire someone and you're promoting internally and the person really doesn't know the job, you're going to pay for it at the end of the day.
Mhm.
And you also
Well,
don't
and
want the
then
person to feel unvalued, maybe devalued and
mhm,
not appreciated. I'm sitting with
mhm.
you doing all this work and you don't think I deserve something better. So, I mean, there needs to be balance. Yeah.
I think we also have to remember that just because we've promoted someone, our responsibility to them does not end, right?
Yeah.
So that we owe them, and that these people that we've put into these roles, they still need mentorship and development. They still need growth. When you are promoted in a role, there's a transition to that new role, a transition to practice period for that role, just like there is for any other position. And acknowledging that and supporting people as they grow into those roles is extremely important in ensuring their long-term success.
Yeah.
Aubrey, I'd like
Thank you
to
so
add a
much, Aubrey.
comment.
Does anybody want to unmute and ask the
I
question?
think Dr. Gant's trying to.
Okay, good.
Yeah, so I was just going to highlight when you talked about emotional intelligence and self-awareness, you know, I have an appreciation for how that ties in with cultural competence as well, and how the self-awareness goes into that, and they build on each other, being aware of differences in views and how people go about doing things. I personally, there's certain ways I like to do things, but that doesn't mean my way is the only way. And recognizing that it doesn't have to be your way to be correct. And that's, that goes into your emotional intelligence and cultural competence playing a part in that, being able to adapt your ways to fit other people and acknowledging their importance. And I just think it's amazing how all of that goes together.
It's a important part of how you respect and collaborate with other people.
Thank you so much, Aubrey, for the response. And, Jared, like you were saying, it's actually I think there's a long continuum with when you talk about self-awareness, because looking at all those things that are incorporated into self-awareness, I think it's even way beyond just emotional intelligence and cultural competency. There are some things that even our mindsets and environment build into us that we need to deal with as we rise to certain positions, especially in healthcare, because I don't think there's anywhere you find a mixed multitude like in healthcare. In terms of the patients and the populations we serve, and also the people that do the serving, that provide the service, there's a mixed multitude there that's really not found anywhere. Probably the only other place would be a school. Yeah, maybe, but in healthcare, everybody's right there in the mix because we all have a body that needs to be healthy.
It's our blessing, right? And it's our challenge to rise to.
Yeah.
Because we have the opportunity to serve so many different types of people. And you are going to be within healthcare, a part of people's lives at their best and at their worst.
Correct.
And how you impact them can have long-lasting effects, both positive or negative. It's a really remembering that, and not just with our patients, but also with our colleagues. The diversity amongst healthcare workers is really amazing. And I consider it a gift to have the opportunity to work with so many different types of people, different disciplines, different training, and it can be challenging. It's not easy, right? So you've got so many different types of perspectives that you're engaging with, but it is also one of the biggest gifts if you can embrace those differences to be able to really impact change in a positive way and impact people's lives.
Yeah, thank you. Thank you, Aubrey. Thank you so much. I don't see any more questions in the chat. And I please, another reminder from Dr. Barnard to please click on the evaluation and complete the form. And also, if you were not here when Dr. Michael posted the assessment, we're requesting that people please respond to the assessment to help us follow up with future webinars like this. We were trying to figure out the kinds of educational material to present to people. But this has really been a very good and engaging time with you, Dr. Pepper. Thank you so much for the time. Thank you for this conversation from the heart, really. I think it's really from the heart, shared a lot about your experiences. And I believe some of us can identify with some of those things you went through, transitioning from one state to the other, and also even changing roles. It's something that actually could lead you to make strange decisions. And you're like, but one thing I must say, I like you said, and I made a note of that, is there are multiple leadership styles, yes. And you might think you will never practice one particular style, but the time will come when you will see yourself, leading in that way that you thought you'd never, do in your life. And I think it's something we need to understand. In healthcare administration, there's a lot of fluidity and dynamics or dynamism that's there that makes it necessary that you have to change your pattern from time to time. And if we understand that, it's going to be something very helpful for us too. So
You have to
thank
think
you.
of it as different types of hats, right?
Yes.
Like sometimes you need to wear a sun hat if the sun's bright. Sometimes you need to wear, you're putting on something stylish because, it's a fun time. So, there's different times when you need different hats. And I have to think about leadership styles that way. Sometimes I change my hat. It doesn't change who I am at my core, but I may have to put on different hats and employ different styles to carry out a goal or an initiative.
Thank you. Thank you so much, Dr. Pepper. Please, a really beautiful presentation. And
Thank you so much for the opportunity. You guys have been a
yeah,
wonderful and engaging
yeah.
group to talk with.
And don't go